therapy or counseling session, whether it's manual, more or less or not. Yeah, that is the point. So I will begin with the first one, the summarize of the program. Okay. I will remind you a little bit that we have core skill training 1 month ago or more than that. Yeah, that is the we make you group of 3 people and practice 3 different programs. Yeah, that is the tranquility development, mindfulness in activity, and mindfulness education. This we call skill as a as a way to help you to understand mindfulness in the and meditation in different way. That means in psychology and neuroscience. Yeah, because you are in the meditation master, you will get used to the concept of Buddhism. But nowadays, you know that mindfulness become widespread, worldwide. And by this way, they use maybe different approach, different language, even come from the same concept. So, course will help you to see first the concept. So, second, the way to develop a skill that in modern day. Yeah, that will be something that helped. But the main program will be the therapy of the X session. As I mentioned that you can the X core program that you get in the manual they do in a group fashion, but actually mindfulness-based intervention can do 3 different ways. Yeah, in the individual or in the group therapy or in the classroom. Yeah. Yeah, is it like in the classroom? Yeah. For example, the classroom of mindfulness that we see a lot is a workshop or mindfulness classroom for people with NCD, people with a non-communicable disease group. They will not go into individual story a lot, but more on developing skill. They can do in classroom. Yeah. But in our program, we focus on individual and group because that will like a therapy and counseling that help let people have opportunity to bring about the life issue, the personal issue into the therapy. Yeah. So why we call therapy and counseling. Now begin each session. Okay. Shortly, you will see that in session 1, the objective is tranquility development. But because of the session 1, you need orientation first to let people know each other and introduce yourself also. And then you have an ice breaking that talk about the beloved person. So you can remember, Gianni, you do that. The beloved person. And from this beloved person, people have opportunity to open self-disclosure and become have a better togetherness or group cohesion. And they also learn that everyone has some positive characteristic. They learn socially from the beloved person, but this characteristic cannot show up when they have stress or emotion. So by this way, if people learn higher consciousness of tranquility and mindfulness, people can better go along with their emotion and stress and can show up and can develop more of these positive characteristics as tolerance, compassion, and so on. Yeah, this is the second part. And then you go to the tranquility development 3 steps. Yeah, the how to stop thinking, how to manage with subconscious thoughts, and then how to manage with sleepiness. Okay, this is the process of session 1. In session 2, you begin with review the first session, and then you go into mindfulness in physical activity. You begin with basic mindfulness first, awareness of breath, awareness of doing things. And then you have opportunity to compare what is the difference between the consciousness of these 2 different consciousness, that means tranquility and mindfulness. So people can see that tranquility is a latest state of mind, but with full awareness, not like sleeping. And mindfulness is a working state of mind, but with less distraction and emotional involvement, not like awakening. So this is the basic mindfulness that people learn from practice step by step. 1 minute close eye, 1 minute open eye meditation, and then awareness of breath, awareness of doing things. Then it's go to mindfulness with outer situation. When that means people can have opportunity to practice mindfulness in daily life in different situations. If they want to become more attentive, they can more aware of what they are doing, less on breath. But in opposite, if they are in the different difficulty, they can easily still work, still do things, but more awareness of their breath. So this helps a lot for people to see that they can use the mindfulness in doing things in different way. Yeah. So until now, this is the second session. People still don't get the concept of letting go of mental activity like emotion or negative thought. So it will follow later in the next session. Session 3 is mindfulness of feeling. So you go into 3 steps. You begin with seeing tiredness. That means you learn to focus on physical sensation first. Yeah. So people learn focus of heartbeat, for instance, and then they go into more meditation way. That means doing body scan to become more sensitive to body sensation and to become self-awareness a lot. That is the concept of body scan. And during body scan, when they encounter any strong sensation, they learn to focus, not to react, but just observing and see how it changes with awareness of breath. Help them to become mindful and not automatically react, but can help them to observe. Yeah, this is the body scan technique, and then they can go into how to apply in their daily life by by using mental rehearsal. Mental rehearsal is a very strong it's a very effective tool to help you to connect what you train with the daily life. Because when you visualizing things, the brain will react like you return in that situation again. So you can have opportunity to practice. For example, you can see your heart rate, your palpitation, your discomfort stomach, and so on. And then seeing how it changes without reacting automatically. Yeah, that is the point. So this is the session 3. Then session 4 will be one of the it's the longest session. because it begin with two introduction concept about negative thought first. Do you have any positive thought? Then they give you 20 items that you can you can assess yourself. Do you have any negative thought? Yeah, and then the second exercise will review situation related with negative thought. That means everyone have a tendency to patterning, to become pattern of negative thought. For example, someone may don't like traveling to work, someone don't like encounter with customers, someone don't like to return home and have problem with couple and so on. So this become negative thought that repeated again and again and become patterning. So they can see that why they become miserly with their life, because it become patterning of negative thought. So these two components actually come from the cognitive behavioral therapy, but the cognitive behavioral therapy learn to master this in different way. They just they must identify negative thought and change to positive one. But in mindfulness therapy, we go to the mindfulness of our negative thought, and the technique is that thought labeling. Thought labeling come from the concept that when you talk about negative thought, it's a flow of many thoughts. So when you are in the middle of this flow of thoughts, you see it by labeling the thought. You can see that it's just happening and passing away. So you become not attached to it. So you letting go with the negative one. When people can letting go, then people can see the world or the situation differently. That is the point of this. And then again, do mental rehearsal to apply. Mental rehearsal in this session 4, they will introduce you that think about normal situation that you may get difficulty, need not to be a strong one. But in session 3, they ask you to mental rehearsal of a strong situation, a situation that you don't like a lot. So this is the difference, because to help you see the body sensation representing your emotion, you need a very strong situation. But for negative thought, it can be anything. Yeah, that is the concept of session 3 and 4 differently on mental rehearsal. So from now on, people finish the tool of mindfulness. So they can sit 30 minutes a day. So you see that people not asked to sit long from the beginning. In the first and second session, they just sit 10 minutes only. And in the third session, they sit more 10 minutes for body scan. And then in the session 4, they sit 30 minutes, 10 minutes more for mindfulness of thought and mental rehearsal and so on. That is the concept. So people finish 1 month of therapy, learning basic all mindfulness skill. So the second part, the after 1 month, for the after 4 sessions, will apply to relationship. This is very important, because most of the problem people have is in relationship with the couple, yeah, the son, the parent, or the children they have. So this is a relationship. So then they will learn how to apply mindfulness to this. It begins with session 5. Yeah, relationship review, or you can say contemplating relationship. That means negative thought with relationship is common, because it's is the basic of our fundamental consciousness. We have a tendency to collect negativity. So this is also applied for relationship. So you can see that in the 5.1 assignment, yeah, they ask you what these people do bad thing to you. You can, when anything come up, you write down. And then I try to do any good thing, but without result. Yeah, many things come out. That is our fundamental consciousness. And then you learn that if you letting go with the negative thought or negative emotion, you can mindfully seeing or considering the relationship in different way. So you do the after mindful of thought, contemplating relationship again, you will see some positive side very easy. For example, the good manner or the good thing that that person do, or you can see that you yourself also do many things, many negative things, even unintentionally. So you become seeing the worth of your relationship, and also you see the opportunity to improve yourself. So that is the concept of session 5. And then you go to mindful communication, like this morning. In mindful communication, you learn 3 things. First, you learn basic communication. When you communicate with someone, you need to first attentive listening, eye contact, noting. Yeah, you need to understand the non-verbal communication that communicate feeling, relationship, and so on. And you also aware of your feeling. When the other have feeling, you also have some feeling happen to you. So this is the basic communication part. And then you learn how to communicate mindfully, awareness of breath, awareness of listening and speaking. And listening for mindful speaking is a little bit difficult comparing with mindful listening, because you during your speak you have only in breathing, because our breathing change to become your speech. So you need to observe it. So you learn from singing the song, a short song of happy birthday. You get I understand that, oh, this is the in breathing that I have every time I talk. And then you change to mindful communication skill again, talking with A and B, and then B and A. So all is the mindful communication skill. But the most important thing, go to the third one, how to apply mindful communication into relationship. So you think about bad event that you have problem of communication with your relationship, and then you visualizing that if you are aware of breath, listening, aware of breath, speaking, you can communicate different way. For example, you can express yourself more. We call I message, because usually when in psychology we observe that when people get emotional, they react automatically, and it's usually you message. Why you do that? Why you talk like that to me, or something like that? It's always you message. But when people become more mindful, they can express themselves better using I message. Because you message mean that you criticize, you teach, you don't, you blame the other. But if you use I message, it means that you just express your feeling and your thought. So it's become easier to communicate and working together. Yeah, that is the concept that in with mindfulness you can better communicate non-verbally and verbally, especially with I message. So, and then actually in the process, we have two different methods to help people apply into relationship. The first thing is that you visualizing situation, you do mental rehearsal, and then change from negative one to the positive one. That is the first method. The second method, you allow people to rehearsal in reality. In psychology, we use the term enactment. So, for example, you let A and B rotately play role of the event. Yeah. When A play as the A story, B will play as the communication partner of A. And then you reverse, B play as the B story, and A play the role of B communication partner. So by this way, people know that it's not just it is not just mental rehearsal, but it can apply in reality. That you can and it's totally different when you speak and listen with your fundamental consciousness normally, and you apply mindfulness into your conversation. Yeah, that is. But this morning we don't have time to do that. But in the manual, it says that you should let people do enactment. So acting it into using role play, acting it, and then people can learn more and more by this way. Is that all right? Yeah, that is. And then the last session of the therapy, I mean last session in the way that you introduce new tool, because the session 8 they don't have any new tool. They just summarize all the program and then let people see what to do next. But in the session 7 is compassion. We call mindful compassion. That means people learn to become self-compassion by hug them, by do body scan, thanks the each part of the body, and then hug oneself. So that is the way. In psychology, we do for self-compassion, and then you do the three things together: compassion to the one with conflict that you have conflict with. This is very important because every day you have anger with someone, no? But and this anger harm you and your relationship. It harm you because it make you emotional, make you suffering, misery, and then you react to the one you anger. So they also become disturbed from this kind of emotion. But when you can letting go, you can see that the other one also suffer a lot. So you can forgive and you can develop loving kindness to that one. So this is the first thing: compassion to one with conflict, and then loving kindness, not living. Loving kindness to the people around you, and then loving kindness to all living beings. That is the second part that we do yesterday. Okay, yeah. So that is the summary of the 7 session. Do you have any question from the program? So if you see the tasks of the therapy, they have two things. The first thing, you you conduct skill training in stepwise fashion. So you see everything is in stepwise. So people get easily to learn. Yeah, that is the first part of therapy is conducting skill training in stepwise fashion. That is the first thing. But in a group therapy, people can learn from each other, and people have different uh, different way to learn. So the group process will help. So in group therapy, we introduce group dynamic or group process. The group process means that you run 3 steps. Yeah, that let people learn from each other. So they begin with ask experience of the skill or of the step of skill that they just learn, and then share understanding of that tool, and then apply to use either in sitting or in daily life. So that is why we talk that you cannot do only first step, ask experience. You need to go into 3 steps. And by this, you can make people develop what we call group process. Yeah, that means people we see that is universality, that people have problem, people can learn, and people also can learn. And then they will develop more and more group cohesion. They feel that they become one part of the group and feel engagement to come. Yeah, because every time they get self-disclosure, they become one part of the group. We call group cohesion. And the last one is group learning. That means everyone can learn slow. Someone can learn slow. Someone can learn fast. But they can learn. So by sharing in the group, people will develop group learning. This can be done by the 3 steps. Yeah, that is why I focus a lot on every feedback after the session of these 2 things. Do you stepwise conduct the training? Yeah, if some step miss, I will ask you to see the manual that maybe you need to follow the step that help people to practice. And then I will focus a lot on the group process, whether you run according to 3 steps that will help people to learn properly. Is that all right for you? Yeah. Okay. This is the same thing. Ask experience, share understanding, and link apply to sitting and daily life. So I don't know. Some of us already do in therapy. For example, Yani, you do in your work formally, you do individually. Uh-huh. 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 So the question is that what is difference between doing individual therapy and group therapy? In psychotherapy, we call different words the mechanism to make people change. In individual therapy, we call therapeutic relationship. What does it mean? Therapeutic relationship. Therapeutic relationship means you empathic listening, and then you and then during the course you listen to them empathically, and then if you have some reflection, you reflect it empathically. That is the therapeutic relationship in individual therapy. But in group therapy, you cannot do something like this with 8 people in the group. So what you do instead is the group process. So you let people understanding universality, group cohesion, and group learning through you develop this thing through the 3 steps of group process. So that is the difference. And you may ask why we train in group therapy, because therapeutic relationship can, if you learn, you cannot do group therapy. But if you do group therapy, it has some property of of empathic listening and reflection from yourself. So you can do individual therapy, not so difficult. So that is why in training, we focus on group therapy. But in the certification, you need to do both individual and group. Okay. Is that all right? Okay. So in the manual of the therapist, you will see that we have objective and then content and then activity of overview of the activity, and then you have therapist document content of two parts, the knowledge and the script. You see that actually it design the script for you to explain by yourself, not to read. But the script is something that developed to be a standard script that you need to read properly. But in the training, we allow you, so someone still reading the knowledge. Actually, you in the therapy, you cannot read before your client. Yeah, you need to explain by yourselves. But in the practice, we still allow you to read more or less. But in therapy, you need to understand by yourself properly that you explain. It's like a campus. It's like something that help you, not to read. Yeah. But the script is really important to read and read properly. Someone read too slow, someone read too fast, then you can see that this every time I ask you to review the sitting on activity 1 and 2, because you can learn slowly that you can read the instruction properly, not too fast, not too slow. Okay. And I have an offer that every time when you sit, you can practice talk with yourself according to the script. Yeah, you close your eyes, take 5 or 6 times of long breathing, observing the sensation of breath that you feel best, and so on. So every time, then you will keep the rhythm of your script very well, because you get used to that. This is the properly reading the script, not too fast, not too slow. No? That is the point. And you will don't read the part of knowledge. All right. And then you have activity forum that you distribute to the people to let them assess their training, and then help them to easier sharing with each other. That is the activity form, and then not forum form, and then the homework. That is all about the manual. Yeah, our manual developed in Thai language, and then we translate into English. So maybe sometimes it's not properly for you, or some misunderstanding. I must say that I'm sorry for that, but I will pick up any reflection you give and try to improve it. But it's come from the original Thai manual and then translate into English. Yeah. Okay. So we divide into the group, and then we rotate to be therapists and group member, and using about 1 hour for each session. Yeah, we have meditation, homework review, and then group process of meditation and homework review. We introduce new skill stepwise, and then have group process of the new skill, and then give homework. So the structure of each session will go like this. And then we have a feedback we lead the session plan together. We allow therapists reflect first, and then we give mindful feedback. What will be better? Yeah. Okay. That is the way. Okay. Before go to the next step on application of mindfulness-based intervention อาจารย์ช่วยเปลี่ยนเป็น I will using the assessment form of the whole 7 session one by one, and then let you see again. This assessment form is very important for the beginner, not only for practice in the class, but also when you begin to see client. Every time you can before meeting, before see the client, you can study the manual properly, and then you can see the assessment form that will help you to check yourself that you will run properly. And then after the session, you can review yourself again. Yeah, using this, it will pick up some very important point from the manual. Yeah. มันเคลื่อนได้ไหมครับ Okay. Let's begin with session 1. Session 1 will show you that you begin with introduce yourself and provide orientation. You can read in your form if it's too small. Introduce yourself and provide orientation, explaining the concept of mindfulness psychology and therapy. And then you giving instruction to recall beloved person activity. Yeah, think about your beloved one, and then you exchange some question to help people learn from the beloved one activity. For example, what is the common characteristic of the beloved person? People will say tolerant, loving kindness, compassion, so on. So you will see the common characteristic, and then the second question will continue. Do you get this characteristic from your beloved one? And everyone can see that yes, it become one part of our character. We call social learning, no? Then the last one is very important. We will ask people to see themselves that you have loving kindness, you have tolerance, you have compassion, but why sometimes you cannot show it up? And people will explore oneself and see that, when I have emotion, when I under stress, I cannot show it up. So it's come up with the connection to the therapy, that with your fundamental consciousness, you collect negativity, become stress, emotion. So it will prevent you from showing this good characteristic. But if you learn higher consciousness, better quality of mind, you can better show it up and cultivate this characteristic. Yeah, that is the point of number 3. Exchange 3 thought-provoking questions, and then summary and link to transcript meditation and mindfulness practice, and then you explain transcript meditation in the psychological term. It is a latest state of mind that you begin from stop thinking until you calm and relax, and then you practice 3 steps. Stopping, managing thoughts from subconsciousness, and managing the sleepiness and drowsiness. Then you get good process to go on, that people can master the skill of transcriptive development properly. And then you give homework. Yeah, that is the process. So I will invite people who run this part. Yani, yeah, what is your when this assessment help you to see what you have done? Do you have any reflection for the group?
Okay. Yeah. So I was confused about the assignment. So there was some parts that I missed. I didn't prepare for, like the beloved meditation, person meditation at the beginning, and also I could have had added more questioning in the process of evaluating this meditation, and also the experiences of the tranquility meditation. So I need to brush up my interviewing techniques and also how to gather the information from the group and how to summarize it and conclude it. So that's definitely something in the group process of facilitating the group process that I need to improve. The other factors, explaining the concept of mindfulness psychology, in the future probably will prepare something like a summary of the theory when beginning to work with the individual clients or the group, like a presentation or something for the first session. So it's something that I can reflect on when I start doing the tranquil meditation. So that will help. In this session, I didn't have that prepared. So that's also something for the future. With regards of the going through the meditation and the steps, I was following the manual and I was doing it according to the manual. So I didn't have much extra for this session. So basically, I think overall, getting more versed into, facilitating the group process, adding more questioning, doing more summaries, and that's something to improve. Yeah.
This is not only self-reflection, but he also give you the hint or the clue that next time when everyone do this session, how you can improve. Yeah, this is very important that it's not only reflecting yourself, but you also teach other people that or help other people to learn how to make it better. So you see that Yani focus on the linkage of the beloved person to the practice of mindfulness and tranquility, and introducing the concept of mindfulness psychology. Yeah, that is one thing. And second thing, he mentioned about how to train the 3-step properly with the good sharing or group process. Yeah, that is. Anything? Do you want to reflect more from the reflection? Are there any comment? Okay. When not, we go to second one. Yeah. Okay. Sorry. The mindful living. It begin with lead the group, transcript meditation, and review homework, and post review group process, and then explain mindfulness in a psychological context. Yeah. And then practice basic mindfulness in 3 steps. Then provide instruction and group process, exchange difference between concentration or tranquility and mindfulness. Then process and summarize the difference you let the group share and then you summarize and then explain and practice mindfulness in external situation. For example, standing on one leg, and then explain and practice mindfulness in internal situation. For example, standing in squat position or listening the negative story, yeah, or do both, yeah. Do group process and summary and then give homework. Yeah, that is the process that you can assess whether you do according to how well you do that. Yeah, okay. Okay, Matthew, as you run the second session, can you give some feedback that will help people to do it better in the future?
Yeah, I've undergone quite a comprehensive reflection. Which part? I mean, the let me just have a look because I've already wrote a lot. Yeah, so I'd say all the critical sort of feedback that I received with my session seemed to function around two main themes. So that is one, timing, and two, facilitate a talking time. So obviously in the beginning, I endeavored to include all of the information listed in the handbook in my session, because I feel as though I misunderstood the function of the task prior. So I thought, okay, I've got to get all of this stuff out of the book and delivered, and 1 to 2 hours it gives me the full sort of block. So in the future, and this is kind of like what I've written for most of these things is, yeah, probably just tailor the descriptions of things to the character of the group. So get a read on, like, you know, what if I'm going in, because I have a tendency to go into a lot of detail because I've been studying this stuff for quite a long time. So I struggle to come down from the deep explanation. So for me, I would say keep it more casual in layman's terms, and then just have the understanding in case people, you know, give them the opportunity to ask for clarification. And then that's when you can give the deeper explanation if necessary. Otherwise, because it's a therapeutic thing, I reckon aiming for, you know, sort of 30 to 70% facilitator to participant, you know, talking time is more suitable for this. So that's like emphasizing the group process, you know, instead of just sort of going one by one, allowing it to become a more organic and communicative type of process between the participants, and then obviously listen for teaching points from there. So I'd say that's what I took away, is just, you know, be more mindful of, you know, the depth of explanation and allow for more organic contribution from the group.
Yeah, thank you for this reflection. If you can see that this second session is very important because people need to maintain mindfulness in doing things for a long time, no? So they need to understand properly and apply in their daily lives. So you see that the third one, apply in daily life must be very clear when you let them share about mindfulness in external situation, what they can apply in daily life. So you go around that people help, yeah, in this situation, and also mindfulness in internal situation. In which situation you can apply. Ask the body, allow the group, and then they will come up with enrich more enrichment on understanding and applying. Okay, the people cannot get that. I can external situation mean I stand on one leg. No, but in any situation, regard that they need more attentiveness, they can do like this. And then also when think about mindfulness on internal situation, they don't only think about standing on squat position, but anything that they get difficulty, they can more focus on breath. Is that all right? Yeah. Now come the very important question that I ask you. What is the difference between mindfulness in internal situation and mindfulness in mental activity? The letting go of emotion and thought. What is the difference? What is the difference between mindfulness in internal activity and mindfulness of letting go emotion and thought? What do you think?
Mindfulness with relation to external activities is focused on what we can't control in terms of the external conditions, whereas internal mindfulness is about management of our response to it could be something that comes from the subconscious or reflections on situations or perceptions of certain things. Yeah, I don't know.
Yeah, send the microphone back. Maybe another lesson, please. What is the difference?
So when you say the external situation, is it like things happen to you or just
internal?
Internal.
My question is, what is the difference between mindfulness in internal situation and letting
go? I think it's the part of it, right? Like internal thing is like things happen to you, like thoughts coming to you, and then letting go is the process of your brain. So step 1 and step 2. So they kind of related to that, but they're different stages of your thinking or your brain process.
Yeah.
I think for letting go, you have to have a deep, like a realization, reflection before you let go. If you accept the situation, okay, you can let go easily. If you don't understand it, you cannot let go. Like wholesome and unwholesome, you can differentiate and find the truth.
Yeah, you are right. But I would like to add one more things. When you think about mindfulness according to internal situation, it's still mindfulness in doing things. You still do things. Yeah, it's still about physical activity. For example, you listen or you cook, and then someone criticize you. You still keep listening and keep cooking, but you're more aware of your breath, so you become not so reactive. But it's still focused on doing things. But in letting go, it don't talk about doing things, but it talk about your mental state. You letting go with it. Yeah, you just see that your face you get hot face. You are aware of it. See how it change, and then you letting go with the anger. It not focus on activity, but it focus on your mentality. So that is very important. But you are right that to understand letting go, you need to see the impermanent. That is the next step. But they also focus on different things. In this session, they focus on doing things. But in session 3 and 4, they speak about your mental state. Okay? Yeah. Let's go to the third one. Okay. We talk about the three leading meditation and mindfulness practice on doing things, and then group process, and then explain how to let go of emotion and practice focusing of tiredness, carrying in body scan training, and do body scan, and then group process on that, and then link to mental rehearsal, do mental rehearsal, and then group process of that, and then give homework. Okay, Thai, please give reflection of you conduct this, and then anything that you can advise your colleague to do better.
Okay, I was conducting session 3, and I was grateful because Yanni and Matt have finished session 1 and 2 and clarified a lot of things, also techniques. So on their grounds, it was easy for the group members to conduct tranquil and also mindful practice together. So for the first one point, and also the second one, it was much easier because the group has better understanding already. And I was lucky to have that understanding from each member. So the group's process was smooth. And for my part, in this session, we learned something new, which was body scanning, and also mental rehearsal. That was the new subjects to session 3. And body scan, it was not a very difficult concept because we focus on our body sensations. So it was easy for group members to pick up the idea and then practice together. And for mental rehearsal again, on the basis of knowing how to practice tranquil meditation, and also pay attention to one nostril breathing. And I don't think there was difficulty for group members to practice this one. However, after I went through session 4, 5, 6, and 7, I learned one more important thing. And at that time in session 3, I didn't know that technique to incorporate that technique in session 3. So which is the 3 steps, like the ask, share, and apply. So these 3 steps, like techniques, actually are very important when we do the group process. So in session 3, I was not aware of this technique very well. So if I had a chance to do it again, I would incorporate this 3 steps technique much better, and then probably will have better answers, and also group interactions among each other. And that's something I would do in the future.
Yeah, thank you for this reflection. Yeah. So you it's natural that in the beginning you still don't get used to the group process. But when you practice more and more, you will see that group process is not only arc experience, but go to share understanding amongst group members. For example, people understanding that they can observe body sensation better with awareness of breath. Help them to being present and see their body sensation. And then rehearsal, let them easily to apply in their daily life. When they think something in a bad situation, they get hot face, get palpitation, then they can just observe, see the impermanent and become neutral. Yeah, that is that they can any time they encounter this situation, they can apply. Have you already during the weeks applied this, seeing your sensation when you get emotional? Yeah, can you make example?
No, a lot of during this week when I joined this course, mindfulness therapy, so I also aware of that, especially any situation challenge my emotion. For example, when I observe my craving with food, and when I make something make me not happy. For example, if I go to bed late, when I go to bed late, I'm not satisfied with that action.
to my body, to my health, and I a little bit frustrated. But before I sleep, I relax my mind. It's okay. Today I accept and I just review all the good things I have complete and come back with my breath, relax my mind, and that feeling disappear about the negative talks about myself, because negative talks create the emotion. When I realize my feeling is not happy when I go to bed late, I see my thought is you are not good in keep your body healthy. So when I realized that thought, so I stopped to criticize myself. But before that, and after that, I changed. Okay, I changed. I choose study. I choose study and continue. And finish my to-do list task before sleeping. So it's because I choose that. So maybe I go to bed late. So after that, I relax. So easy to sleep. Yeah.
So it's so you can differentiate between two things. One is the focusing the sensation when you get emotional, and then you can labeling the thought when you get some negative.
Recognize negative thought. What negative thought hidden in my mind make my feelings negative?
Yeah, and I ask you to see why begin with emotion, not why, not begin. They let it go with emotion. Let it go. They go to let it go with negative thought. Why not?
Feeling of emotion easy to see, but thoughts is to me is difficult if we don't spend time for that.
Because thought is like go with which station you encounter and which sensation you encounter.
Before the class, I only notice my I think it's not sensations, but as when you get angry, you feel your body lose control. You your brain lost the thought. But then when I started the class, I noticed those feelings. But then I just go deeper into that to see why my body started to shake. I'm losing my words when I'm angry, and I still don't have the answer. I just have more sensations. So the body reaction to the emotions, that I feel stronger when started the class. So maybe with the breathing in, so I can see it more, but I still don't, like I can calm my body down better than before. But I don't know how to explain this too. But yeah.
Compare that body sensation and feeling is like two sides of one coin. Every time you get anger, you get physical sensation. Every time you get anxiety, you get body sensation. Every time you get depressed, you have some body sensation. So that is the point. So we can see our feeling by observing our body sensation, and then we will understand the truth that is just impermanent. So you need not to react. You just see it happening and changing, then you neutral. Yeah, that is the point. No? Okay. Let's go quickly to the session 4. Yeah. Session 4, we conduct meditation and then have and review homework, do group process, and then begin explaining negative thought as automatic thought and their consequence. So you give them 20 item checklist, and then group process on this, and then explain relationship between negative thought and daily event that become pattern of your misery. So, and then group process after that. And then you invite people to learn practicing labeling thought. And then you do mental rehearsal. And again, run the group process that people understand properly, and then give homework. Okay? Yeah, microphone is in front of you. Yeah, you run both. You can reflect, reflection, and then advise colleague how to do it better.
Yeah, we the first of all, because this is the group therapies we do together. So the first one, we need to prepare carefully, and we need to work together. We need to do rehearsal together. So in my team and Jinwi spend time for work together before session, maybe and we do rehearsal in the same in class. Yeah. 1.5 hour before we do for the real group outside. And the second thing, we need to have a time for ask the Achan about something we don't clear, right? We have something don't clear, but in yesterday we have not enough time to ask Achan before session. So, for example, the share experience, we just ask people share experience. We don't know what exactly how to create the specific questions for the client to answer right. So it's a thing we concern. And about the during the
and
session.
now you know how to link with the applying, how to link with the applying in daily life, how to make people link with
about the question.
labeling the thought labeling, how to apply in daily life.
So in this is specific case, or
in this session.
In this session, I have no idea.
Yeah, I think maybe after practice, when we do the group process, yeah, we can try to use their sharing and link to, and also the homework. We can ask the group members maybe what you have learned today and how you can apply in the daily life.
Yeah, there are 2 points that you can do. The first point is that mental rehearsal. When people do mental rehearsal, it's applying in daily life. So let them tell the story, the story, not just the technique, but the story, what they think about, and then how they labeling the thought and become neutral. And then the homework, you can link them that in the homework assignment, they have, if you do every homework, they will have open-end question at the end. How you can apply in daily life. So let if you encounter any difficulty, and then you can do thought labeling, please write it down. Yeah, that is the way you can link to daily life, applying in daily life, right? Yeah, the mental rehearsal part and the homework part. Do you see that at the end of each homework they have open-end question? Yeah, that is the applying to daily life. So you let's explain this to the people. Okay, yeah, go to the next one. Session 5, mindfulness in relationship. Yeah, we do meditation, review homework, group process, and then exploring negative thought of our relationship, the 5.1 and group process. Then you explain and reflecting that relationship can be better if you think positively, and then you do mental rehearsal. Let people contemplate mindfully on the relationship with the 5.2 assignment and the group process to make people learn, and then you give homework. Okay, we have Maya and Magdalena do this. Please give some reflection and advice to your colleague, please.
My reflection is, I think this part is very important because nobody wants to have negative thoughts. But if the negative thoughts accumulate in their mind, it's not healthy. And you can lose the chance to develop loving kindness. So the important part is we need to think about if we use mindfulness or not in our communication, and what bother us in our relationship when whatever is negative is between family or friend. That's very important, especially family, because we meet each other every day or often. So this part is like helping us to remove the negative energy if we continue to practice this, using these techniques to apply in daily life, using the mindfulness and in order to find out how would be increasing or better relationship in the future. Even they have some misunderstanding, it can overcome. If we think mindfully, we speak mindfully, then we know, okay, we can use forgiveness, apply into this. And then in order to make the relationship, instead of negative, to make it positive. Yes. Any question, Ajahn?
Yeah. I think yesterday, Yani, you have a very good hint that in this kind of therapy, we don't change our thought. We
Yes.
change our consciousness. So when we can let it go, we will see world differently.
Is it the concept, right?
Yeah,
We need to switch our concept in the
this very important.
solving problem.
Yeah, because in the mainstream psychology,
yes,
they teach you how to improve your thinking by identify the negative thought and change to the positive one.
Yes, that's very.
But in the mindfulness approach, they will encourage you to apply higher consciousness, so-called mindfulness, and then you recognizing positive thing from letting go.
Yeah, especially when we are mindful, we will acknowledge them easier and faster.
Yeah.
So the more we practice, the more we can let go. Yes.
And usually, this session is very strong effect on people, no?
Very sensitive.
Yeah,
It
very
touch very deep,
strong
right?
effect,
In
because
the
they share a lot of personal things
right.
to the group, and then they learn that they can see the world differently.
Especially touching the family issue. That's very.
Yeah, definitely.
Yeah.
Family issue is the strongest component.
Yes, exactly.
Yeah.
Can I share something like it's affected this? Because like few weeks ago, I heard about the news in Hong Kong. Like there's a man, he doesn't like to how to survive. He doesn't like the world. So he was very negative. And then actually he has a wife and has 2 children. And then he killed his children and killed his wife and killed himself. So just because of emotion. So you see the negative thoughts can accumulate. If we do not solve this problem, that is become very danger for not only that person, but the whole family. That's a family issue that happens in the world. So this I think is very helpful. This how can I say, techniques of helping people release their negative thoughts. We rather doing daily life, or we rather doing like in the beginning, rather than facing a problem in the world in the future. So I totally agree. This is very helpful.
So group process is very important in this session, no? Because people will self-disclosure and then learning from each other, from self-disclosure.
To make this world a better world.
Yeah.
Right.
So let do according to the step-by-step wise, and then also let people share a lot on their own experiences. Yeah, that will be the positive strong effect on each member of the group. Okay. Yeah. Go to the next one is the improve communication skill we just learned this morning, nah? So we have we omit the first activity because of time. So but in reality you do meditation, you review homework, you do group process on that, and then you explain the principle of communication, and then let people do communication skill, attentive listening, and then can catching both verbal and non-verbal cue, especially non-verbal cue that reflect emotion. Yeah, and then evaluate the communication properly from A and B. Then you so evaluate communication from B and evaluate communication from B. Yeah, and then you go to explain mindful communication. Let people learn how to mindful of speaking by singing happy birthday song. Yeah, and then let A and B try communicate again with mindfulness, and then reverse the law. Yeah, that is the first part. And the second part, when people can master mindful listening, mindful speaking, please apply into the real relationship. So you let people think about the negative communication that really happened in the last week, and then doing small awareness of your small doing a little bit awareness of your breath, and then you can contemplate again how to change your communication, applying mindfulness in communication, and introduce the concept that if you use mindfulness communication, you can easier use I message, because naturally when you automatically emotionally react, you use you message. So when you become calm down, have mindfulness, then you can much easier using I message. Is that so right? So we have two feedback. Yeah, please.
Some share refresh. I agree that we learn from the group, and also agree with Tai just share. So grateful for that. I learned from the previous group a lot, and also during the group process, like I know how to practice this, and also from the sharing from the others, maybe like Matt and the others, and I also I learned a lot from during that group process, and some refresh. Yeah, maybe like because for me sometimes feel a little bit shy, especially if just imagine that maybe stranger, then to sing the happy birthday songs together, maybe feel a little bit strange, a little bit shy to do so. So maybe if not about the melody, just to speak the words happy birthday, or something like that, or maybe count it like 1, 2, 3, 4, but just with mindfulness. I'm not sure, maybe help some other people shine like me.
Matthew smile.
And even if during my birthday, when the people sing the song for me, I feel so.
In Thailand, we also apply Thai song. Yeah. They have they have a song called ลมหายใจเข้าลมหายใจออกดั่งดอกไม้บาน every sentences finish, they will get the inhalation. Yeah.
I think the Thai song is much more beautiful. Maybe
But-
because I
but
don't know the meaning.
if you change the song, you need to try first, because the rhythm of the song is very important. It should be not too fast, because it must slow enough that you can observe at the end of the sentence the inhalation. Why? Our lung have about 2 liters of well, we have volume of our lung about 2 liter. Yeah. When you speak, you use your exhalation. Every time you get in and out, inhalation, in and out, inhalation, you take about 0.7 liter. So that is by average. So when I sing happy birthday to you, it already gone 0.7 liter. So I need to take in breathing. Yeah, but if it's a happy birthday to you, happy birthday to you, it not work. Yeah, you must sing according to it melody rhythm, not too fast, and then you can easily observe the inhalation, and they introduce you to be a little bit aware by doing 30 minutes and aware of your breath with eye closed, and then 30 minutes with your eye open, and then thinking is help for the beginner to observe. But when you can do it, you need not to every time you talk, you need to meditate. It not make sense. It's become your natural when you can master the skill. But in the beginning, it helps when you do a little bit transcript meditation, or you may be aware of your breath 5 or 6 times. That helps for the beginner. But after that, you don't do it. It become one part of your skill. Yeah? Mm-hmm. Okay, any comment on that?
Can I ask a question? Yeah, I'm a little curious about, because from my perspective, the communication skill is a basic skill. So I'm curious why it's not before the mindfulness in relationships, because I think maybe communication is important in the relationship. So why this this is session 6 and
good question. Yeah, the answer may be because session 5 is still some part of is the extension of session 4. Positive thinking come up when you become mindful thinking. So session 5 like the extension of session 4, but in a relationship context only. So that is why we bring about session 5 contemplating of relationship, and then session 6 communication. Mm-hmm. But anyway, people learn both. Nah? Later or sooner. Yeah. Okay, go to the last one. The mindful compassion and forgiveness. This begin with the same thing: meditation, review homework, and then group process, and then explain and practice mindful self-compassion with 3 components. Feeling of your heart, and then body scan, thank each body part, letting go if it have pain, and then hug yourself. That is the component of the self-compassion. And then group process. Yeah, usually very strong group process. You will see very in the therapy. self-compassion is one thing that almost always exists in every people, I can say. So when people have opportunity to send the self-compassion, is very have great effect on them. Yeah, some people become tearing a lot because of this exercise, but relieve their internal conflict on self brain. This very good. Yeah, and then you do mindful compassion and forgiveness with other people you have problem with, people that you the loved one, and then all living things. So together, and then you do good process after training. Yeah. Okay. Could you please?
Reflections on that section 7 is so we were the last class, so thanks to all the class the sessions before us, we learned how the process go. We learned how to ask the group questions and conclusions. So that was kind of like the advantage that we have over other groups. And also one of my my co-therapist, Dr. Nanapan, was very active in like helping to organize the sections, the timing and everything. So that's make it smoother and easier on both of us. On the technical, I think you're right that self-compassion is very underrated. That nobody is very important, but I think it's less focus in mindful or in therapy, because I think they are focused on forgiving or like compassion to others, and that's make it imbalance because you have to love yourself first before you're sending love to other people. So yeah, so just love yourself more, guys.
Okay. Yeah. That's from this practice I experienced myself with our group, namely Carlo and your name called Cao. You. How I spell? M. Min. Yeah. Okay. Min and Carlo. Both. May I explain a little bit from your experience? Okay. Thank you. They have a little bit some misunderstanding to cooperate to run the session together. So we have some small meeting in the evening, and then I see that both become mislead from the experience that cannot understand each other very well on working together. So I think it's a good example that I myself I see both mislead, no? That it's not as they think or as they plan. So if you can understand, it's become important for both to loving kindness on oneself, yeah, self-compassion, and then also compassion on the other. Because working together sometimes is have problem, and then you have different culture, one from Eastern, one from Western. They have different kind of interpreting interpersonal relationship, and then from different interpretation, maybe it make more suffering. So that is the thing that we can learn in our working together. No? Yeah. Carlo, do you have anything to express? Okay. And at the end, I would like to mention that co-therapist is one thing that we do very often, no? And you see that among us, we have two kind of co-therapy. One kind is that you rotate from one to the other activity. So you that is one fashion. The other fashion is that you cut half. The first half one conduct, the second half the other one conduct. For my experience, it can both is okay. It depends on your time, you getting along with anyway. Yeah, but you can see that they have two kinds of working together of co-terrorists. But anyway, you can use either way, but you still help each other during the session. You need to stay on the session and help each other. Yeah, to do some small thing. For example, yeah, distribution paper or inviting people to talk and so. Yeah, that the co-therapist can become helpful for the other one. Okay. Yeah. Now finish the first one. Yeah, take a break, 5 minutes. If you don't want to take the time to 7 minutes, yeah, return on. The definement. It's a lot in Vajrayana, in Tibet, Buddha. They use a lot of metaphor to yeah, it's Dharma in yeah. With monkeys driven, pig, right? And then monster. But and what is this? Some good sentences to make you aware. So it's different. And this word come from Buddha or not? Yeah. Come from Buddha. Yeah. In in Buddhist text, they have a very famous one called Dhamma Apha. It's a short dialogue of Buddha, Dhamma Apha. And then the Dhamma Apha, in the Western country, is used a lot for reference to Buddha teaching.
So they reference it to Buddha.
Yeah.
But they translate it to English.
Yes, but Dhamma Apha. Look at.ได้ครับครับสนุกเลยครับโอเค
You know Chinese. Hi. You know Chinese? Can you read this? You read that. Ah, that's the Can you read this?
Like a wish. Point on the top. For those people who that doesn't work out. Okay. Just they are poetic sentences. They're difficult to translate like anything. Get the idea, but difficult to
I'm sure that we are right for
so
Thai medical doctors, do they keep to the schedule or they sometimes cancel, they don't follow the time? The question, the reason I'm asking, yes, the reason I'm asking is that in this university, they yeah, generally always cancel the class, without don't make up, they don't make up.
No, she has like hold on. How much for climate? Huh? Oh, because it says holiday?
Okay, everyone, let's start our last part of the mindfulness-based intervention, and we have two things left. One is the application of mindfulness-based intervention, and the second one is what you can do in the next step. Yeah. First, begin with application. Worldwide, mindfulness-based intervention have a lot of evidence base that it can be beneficial for two groups of health problem. One is the mental health, and the other is the state-related physical diseases. Yeah. For mental health, they have three groups of application: depression and anxiety, addiction. They also have now the WHO classified two kinds of addiction: substance abuse and then behavioral addiction. In behavioral addiction, they have two categories: gambling addiction and internet game addiction. I myself, I receive more and more consultation on the behavioral addiction, gambling also. Yeah, I have people who lost 6 million baht in one day because they go into the goal in goal change the value every day, no? And then people go into the what you call go in go not inspection, but you predict that if you the value of the goal will come up, and then you bring all your money to buy in what they call, yeah, the future of they play with the worth of the goal, and then they profit, and then next time they think I will lie again, so they They
called
invest
go big
all
or go
their
home.
money. Yeah, and then they lost everything in just a few minutes. Yeah, that is the problem. Yeah. So we have addiction, and then we have post-traumatic stress disorder. Yeah, this is the three group of mental health problem that we use a lot for that have evidence base. I will explain a little bit that they apply a little bit difference from group one to the other group. Right? This standard manual is basically for depression and anxiety, and it's very helpful if people have relapse of depression and anxiety. It's really helpful to prevent relapse. That means usually now when people get depression, they go to psychiatrist and then get pharmacotherapy. They call antidepressant, and then get better from the symptom. But usually 70% will relapse again. And when it get relapse, the effectiveness of the pharmaco reduced. So the standard program accept in psychiatry or in mental health is that combine pharmacotherapy and psychotherapy together. And the most psychotherapy they use is the cognitive behavioral therapy and mindfulness based intervention, either or. So this is the one that when I ask people who get depression and go into therapy, I ask them when they finish, which one do you get useful from the mindfulness therapy? And I get sometimes the answer in the way like this. I apply most session 4. Because this when they get depression, they have a patterning of attachment to the negative thought. When they attachment to the negative thought, they think that they are like that. So, but when they learn to become letting go with negative thought, it's a thought. So become not attached to it and become letting go exist. And this help them to recover from going to depression. Yeah, that is the thing. That is very good. But also people who have anxiety, when they get anxiety, they get palpitation and so on. And when they will profit a lot from seeing anxiety instead of being anxiety from session 3. Yeah, but session 1 and 2 is almost always basic. And then session 6, 7, 8, 5, 6, 7 help them to better going on with relationship. That is the first thing. Yeah, and then about PTSD, the post-traumatic stress disorder is one of the indication to apply mindfulness therapy. But we change a little bit the order of the program. We find that one of the most difficulty the people with post-traumatic stress disorder, PTSD mean that that person encounter a very severe stress and they cannot forget. It's still experiencing that they are in the situation, they cannot sleep well, they have agitation and so on. Yeah. So this help them to be going to difficulty to go along with people. So we change the order of session 7, compassion, to begin early. So after session 4, we begin session 7. That means compassion to oneself and to the other. That means they have 1 month, fully 1 month to practice compassion. So that is only the change. We change the order of session 7 into session 5 instead. Because people who who have PTSD have a tendency to have a lot of self-blame and blaming the other, on their jigsaw, on their what happened to them. So that is the thing, and we slowly introduce mental rehearsal. We not until at the end of the second month, they can even mental rehearsal of the traumatic event and can letting go, blaming oneself and anger the other. That but slowly, not in the beginning. In the beginning, just compassion to people around, but at the end, they can compassion to oneself and the people who do bad thing to them. That is the PTSD mindfulness-based intervention. And then we go to addiction. I write down here what they call mindfulness-based relapse prevention. This is applied both with substance abuse and with behavioral addiction. For example, gambling or gaming. The therapy is the same, this standard, this manual, but at the end of each session, we will have relapse prevention exercise. RP means relapse prevention exercise at the end. For example, they have 3 skills that people with addiction need to heal themselves. The first one is craving management, because every time they get craving, they will go to drug or go to behavioral, and that make people relapse again and again. So people need how to manage themselves when they get craving. We call craving management, and this begins from the first session, because in psychology we know that people get craving because they think about that. So to thinking, craving, and then addiction. So what we tell them to do is that stop thinking. When you have some, when you stop thinking about the drug, and then you can stop the process of thinking, craving, and addicting. So that is the process. So as the mechanism of tranquility development is that stop thinking, focusing on breath totally help you to stop thinking. So at the end of the first session, we will introduce that every time you think about addiction, and then you go into the process of craving, focus on your breath. And then this is the example that at the end we do relapse prevention, applying the mindfulness technique for them. And then the other one is managing with external and internal trigger. The sign of addiction find that people get craving because of trigger, and they have 2 kinds of trigger, external and internal. External trigger mean when they meet friends, they go into the place, they say television about that, then it trigger to become craving again. So they need to understand this and avoid external trigger by doing something else. And in mindfulness intervention, they can use session 2, mindfulness in doing things, to manage their life. They can plan to do something mindfully instead of going to the external trigger situation. That is the point. And then people adjust themselves according to this way of the way of life. Please.
So with mental disorders, you are still, there's a lot of additional psychoeducation depending on the symptoms and the disorder. Are you still using it or doing this in 8 sessions, or do you add more sessions to include psychoeducation at the beginning, or you just incorporate these to the 8 sessions?
Yeah,
so it's still an 8-session program, and then when you choose the clients, you will assess and group the clients according to the symptoms or according to the disorder?
Yes.
Yes.
Yeah.
Okay.
So that's why I explain how anxiety benefit from letting go of emotion, or depression benefit from letting go of negative thought, and so on. So you bring integrate into the session. Yeah. How they manage with their psychopathology we call in mental health. Yeah. So management with external external trigger is very good, combining with the session 2. So they do think mindfully to do something that avoid doing something that bring them to the trigger. For instance, people who speculate goal, every time they see the television talking about the goal, changing the value, they will very excited. Then they must go into speculation. Yeah, and then lost a lot of money by that. So they need to do something else. And that is sometimes difficult, because not to see the news is very difficult. But they also have other strategy. For example, if they cannot avoid, but still interface with the external trigger, they can do mindfulness in inner situation. So they get the feeling of going to the speculation. They still keep doing things they are doing, but more focus on breath. Help them not to go into speculation again. So that is on the session 2. And then the internal trigger is also important for addiction. If you think about people who become alcohol addict, they get boring, they drink. They get exciting, they drink. They get isolated, they drink. Yeah, every kind of emotion they use alcohol again. So by this way, learning to become letting go with emotion and thought become very helpful for them, because when they letting go, they don't need to go to drink. So this can apply with every kind of addiction. So that is, though at the end of each session, we will relate it with relapse prevention. That means people can sharing how to apply when they get some emotion, and then they will that will bring them to use drug or go into that behavior again. So, and people share and then plan themselves that every time they get emotion, get negative thought, they can letting go this. So they don't need to go to using drug or doing that behavior. Yeah, that. And then session 5, 6, 7 is very important, because most of the people who get addict, they have a lot of problem with their family member, with their wife, with their parent, and so on. So to make them develop mindfulness or relationship of session 5, and then have mindful communication of session 6, and forgiveness for session 7, help them a lot to become harmonious in relationship. So at the end of session 5, 6, 7, we will talk with the patient or with the client how to become better going on with relationship and not go to emotional and then drug or behavioral addiction. Yeah, that is the concept of mindfulness-based relapse prevention. Again, it's the same 8 session, but extra at the end of each session. We will talk about how to apply to this relapse prevention skill. That is for people of. So you see that this is how we apply to the mental health problem. But in the other part, there are some stress and state-related disease that we can use a lot of mindfulness-based intervention become beneficial. No? So people may stress without physical disease. Yeah. And or people can get chronic state and be developing physical diseases. This is the list of the physical diseases that very much related with stress. And then usually nowadays, physicians become more aware that they not only give medicine, but help people to apply mindfulness-based intervention to master better with their stress. Yeah, that is and this is the in Western country they use a lot what they call mindfulness-based state reduction, MBSR. Yeah, for this group, and for this group, they apply. In Western, they call mindfulness-based cognitive therapy. Yeah, MBTC, mindfulness-based cognitive therapy. Yeah, that is the program. But in Thailand, we use this program mainly. Yeah. There's some similarity and difference. Yeah. For example, the explanation is somewhat different. We focus on explaining that tranquility and mindfulness is the two mental state of higher consciousness, the better quality of mind, the rested state and the working state. In Western, they don't explain like this. They just say that they have two kinds of mindfulness: focused attention and open monitoring. So in Thailand we call samadhi, no, but in Western they call focused attention. And what we call mindfulness, they call open monitoring. Yeah, that is the different kind of using the term. Yeah, and then in Western they use a lot of yoga to develop mindfulness of physical activity. But in our program, we use partial awareness of breath, awareness of doing things as a part of developing mindfulness in physical activity. And people can do yoga or not, it's not compulsory. But in the Western, it's compulsory to every day practice 40 minutes of yoga to develop more mindfulness in doing things. Because when people do yoga, they will aware of their physical movement a lot and help them to become mindfulness of physical activity. But in our program, we use a partial awareness of breath, awareness of doing things, and in Western, they don't ask people to install mindfulness bell. But in Thailand, we strongly recommend to use mindfulness bell because it's a part of warning system that help them to return to awareness of breath, awareness of what they are doing. So that is the two main difference. And then the body scan, naming the thought, is somewhat similar. Yeah, and maybe one topic that in Thailand different from Western is that we focus a lot on relationship. So we have 3 sessions on relationship, 5, 6, 7. Yeah. Especially 5 and 6, you will not see in the Western mindfulness-based intervention. The contemplation of of relationship and the mindful communication. It is not exist in the MBSR and the MBCT, but mindful compassion is very universal in every mindfulness-based intervention. But the section 5 and 6 is very special for the Thai program. Okay, so you will see overall. To this side, you can dealing with people who get difficulty in adjustment in their daily problem without physical disorder. We have people, doctor, teacher, student who have problem with their career, with their study, and so on. And then they cannot sleep well, they cannot good at their work, and so on. So we can do this. We can do, for example, a lot of people have performance anxiety. For example, the musician or the movie star, sometimes when or the artist, when they perform the work, they get so anxiety that they can do it very well. So this is the adjustment problem that we apply mindfulness-based intervention to help them getting along with their adjustment better. Help them to adjustment better. Yeah, that is the example of applying. Okay. Any question for this? Yeah, you can ask, you can comment. Yeah, please.
Is insomnia included in stress-related diseases, but it's not listed over there, right?
Both. Sometimes you can count insomnia as a physical problem or mental problem. Yeah, but insomnia is now very popular to help people sit before go to sleep. Then when the people meditate, between calm down and then go to sleep, they can sleep better. Yeah, you are right. You can add insomnia into the list. Yeah. You have some question? Yeah, please.
So for the mental disorders, how about if maybe the patient the emotion too strong, cannot feel the breathing? Sometimes they cannot feel their breath very well.
It's the process of learning. People sooner or later can, because it's the reality that everyone have more amount of sensory receptor on their nostril. So some people may be slow, but some people may be fast. But with selective attention, they can get the sensation. We do this for people, anyone who cannot find the breath sensation. But sometimes some people they need to contemplate the word first. For example, in, out, and then later acknowledge that when they say in, they have some sensation. When they say out, they have some sensation, and then change to the sensation. Why? Because sensing the breath is very important to practice mindfulness. And you cannot do everything and say in, out, but you can do everything by partial awareness of breath, awareness of what you are doing. So that is why there's also some very small number of people who very problematic on observing breath. And then sometimes we introduce that they use contemplating of word, for example, in and out. We don't use Buddha because it's a religious one, so we use in, out instead. But anyway, change from the contemplating the word into observing the breath sensation. Yeah, that is.
I still got a few questions. And because I'm very interested in the activities in the coming Tuesday about aging people, something like that. So if like this MBTC module, if that apply to the aging people, maybe read some old maybe will that be some difference like applying to the young generation?
Actually, it's no it's not so much. It's not different. But you need to know that mindfulness-based intervention have no place in treatment of dementia. When people also get dementia, mindfulness is little benefit for them. No benefit, little benefit. But dementia, including Alzheimer's disease, is only in the beginning phase. In the beginning phase, that means early phase of dementia, somewhat beneficial. But when people get severe dementia, no use. So you elderly people need to learn mindfulness before they get dementia. And it's proof that stress makes people more prone to dementia than people with less stress. No? So that means if elderly people, they learn mindfulness and master and then can manage their stress better, they can less prone to become dementia. Okay. So this you need to add the word early phase of dementia. Okay. Now it's come to the.
I'm going to ask a legal question. In Taiwan, for those names, they only belong to medical doctors with licenses. So for anyone who doesn't have medical doctor's license, sometimes they probably give a little bit privilege to psychologists or therapists with certificate from our government. So for a lay like me, I don't have any medical related like licenses, not just certificate, okay? Licenses. I'm not even allowed to use any term like that. For example, I cannot say I'm going to recruit anyone who has like a asthma, chronic pain, headache, to conduct, to participate in a mindfulness-based group. I cannot. I can only say if you have somewhat like a stress, okay, you have pressure, and maybe you have a little bit like sleeping problem. I cannot say sleeping disorder, sleeping problem, and we may help you with mindfulness, like a technique to help you. All those terms, if I mention on Facebook, on social media, then I will break the law. It's very serious. And so the question is, in Thailand, what's the legal perspective?
Actually, it's quite universal. So why we call the program mindfulness-based therapy and counseling. So when you certify, you can certify either as therapist or as counselor. Counselor means you dealing with people who have problem, but not mental disorder. For example, students that have difficulty in doing their study, or people have problem with their relationship, but without depression, without addiction, without PTSD. So this we call counselor. Counselor means counseling people who have adjustment problem. But if people have mental disorder, it is not allowed. Why? Because when people have mental disorder, it's quite dangerous for counselor to dealing with. For example, a lot of people get suicide, and then but you are not knowledgeable enough to know about this. So it's not allowed. People with without clinical psychology background or psychiatric background to do therapy with the mental health problem. That is the first thing. But if they under psychiatrist and then coordinate with psychiatrist that know that you have a license to do you are certified to do the psychotherapy, and then working together under this you can do. That means you do therapy under the license if you are only counselor, not the therapist. But if you become therapist, that means you are psychologist, you are psychiatrist, that then certified as a mindfulness-based therapy, you can do everything because you have your knowledge enough to handle with the difficulty the patient can the patient can encounter. So, for instance, Yanni, you have background as psychotherapist, so he will certify as in mindfulness-based therapeutic counseling. Day we have two categories: certified as therapist or certified as counselor. So Yanni can, by his background, can be certified as therapist. But the people who don't have this background will be certified as counselor. And by counselor, what you can do? First thing, you can do with people who don't have mental disorder but have problem in their adjustment, in their relationship, their finance adjustment, relationship adjustment, professional or career adjustment. These things you can do because it is the work of the counselor. Yeah. Second thing, you can do with these people who have diseases, but only under the license. That means working together and cross consult with the doctor and psychiatrist. Yeah. We said in technical term, doing under license, because it's a law that you need license to handle this. But the people who have license, they don't have time and knowledge and skill to do the psychotherapy. So they let them use, but they will take responsibility if any problem happen. We call in technical term under license. So I train a lot of counselors that they also take care of people with depression or addiction, but under license. That means the psychiatrist know very well that he can give medication, he can assess the symptom, but he cannot do the psychotherapy. So let the MBTC do, but I will take responsibility if there's something happen. This is answer your question.
So Ajahn, you have license, right? Ajahn, you have license, right? Yes. Then you probably need to open a company. Then we become your employees, so we can under your supervision to do this. And we
Only for my ethical, I need to see the patient first, and then I will let them under my therapy, but I don't have time to do the MBTC. I let you do it. But you cannot only ask me and then I sign. That's not ethical. Because by ethical, I can give you do only when I see the patient. Otherwise, I will have ethical problem. Okay, yeah, that is the way it works. But you can understand that most of people are under stress, under adjustment problem, not under mental disorder. No? So comparing with applying to mental disorder and applying to people with problem and adjustment, most people is in the adjustment category. So the counselor will have a lot of work actually. As therapist, Yanni, you have any comment on this? On his question?
No, I think you explained it well. I think there might be some cases or some instances where a person is seeking counseling with an underlying problem, and after beginning counseling, it becomes evident that there might be an undiagnosed mental disorder like depression or anxiety. So in this manual, you have the assessment forms. Would it be wise before beginning or before taking a client into therapy or into counseling with this method, to, if there's no prior assessment, to use the assessment forms to sort of like root out the people who might have, without their their knowledge, an underlying problem, and then not to end up in the situation where you begin with counseling as in a group, and then you realize that might not be enough as a treatment.
Thank you for this point. So what I just explained you, I separate into two categories. Yeah, problem, but without mental health disorder, and then mental health disorder. But this speak about the overlap. There are some people coming to the counselor with adjustment in their relationship, and for example, but when you go along, when you go into the session with them, you suspect that this patient, this client have more than attachment or problem, but they maybe get depression. So it's the ethic of the counselor. When they suspect of mental disorder, they need to refer to the psychiatrist to get proper investigation and diagnosis. It's the ethical. We have in Thailand, we have some problem that some people, they train not so appropriate, and then become overclaim that they can treat so this and that, and sometimes they success and they become egoistic that they can do that, and then come to the case that people get suicide, and then they become going to the court and to be punished because they are not legal rights to do that, but they overclaim to do. So this is in the overlap area. You need to be careful, and you need to understand that it's the ethic that you don't overclaim what you are doing. If you suspect of mental disorder, you need to consult. Yeah, please.
So when you're doing the formation of this program, are you giving some importance or credit to like formation in ethics, like situation?
Yes. We have the ethical rule for that we'll give to you literally, that you can read through and then keep aware.
But you don't see like any like examples to discuss and see like that like making some I don't know, like to realize how the people you are forming, how they see ethics, not like just informing them, just like also like try to integrate them in different conceptions and different situations that they need to realize
Thank you for this point. We will do that during the supervision. because in the supervision, you bring case into group supervision. And then you will see that some case go into the overlap. Or some case maybe have some ethical issue. So it will be better to understand from the real situation. So, but everyone who get certified will receive the ethical principle that what you can do, what you cannot do. Yeah. Okay. That is. So go to the last point. We have about half an hour left. So it's about certification of this program. In Thailand, MBTC become a standard treatment and counseling program. And it's become a certification program. We have 2 different levels of certification. We call basic certification. That means you achieve this, you can do therapist or counseling. You can do therapy or counseling only under supervision. And then we have second category, advanced or certification to be independent therapist and counselor. So we have 2 kinds. I will explain this in first. You need to certify as a basic therapist. Yeah, this have 4 qualifications. The first one is the 17th of January that you participate in the training course, learning the tool of mindfulness-based intervention. That is the first one. The second one is that practicing a group therapy that you do during the 17th, the 11 you do the first one, the 17, the 24, and the 25 you do the second one. That means you practicing being a group therapist, yeah, under the teaching of qualified one, yeah. That is the so you see that it's not only reading the manual and do therapy, It's have a lot of things to be aware, how to become conducting the good process. Yeah. So you need to learn, and then you need to do self-development, practice by yourself. How you become therapist if you yourself don't have proper skill to develop yourself. So you need to practice, and usually we require that you practice at your way of life when you do mindfulness therapy, but demand 1 month that you sit and then you lie down and inform that you have some experience of self-development. That is the third one. And the fourth one, you participate in the community practice of mindfulness-based therapy and counseling. And this, in the beginning, we usually use our live group that everyone share their knowledge and their experience in self-development or in practicing therapy. This is the community of practice. So this is the 4 requirements. So you can achieve this by next month if you do diligently, But because you already have the first 2, you need to do 1 month practicing by yourself and then sharing your practice of self-development into your group. Yeah. And then I sent you in yesterday, I think, the form that you can fill according to these 4 requirements. Yeah. And then they have requirement for advanced certification. That means after you get basic certification, you are allowed to see client and doing 1 group, 1 individual therapy, and then go into the group supervision that you can learn not from your case, but from your colleague. Yeah. This will continue for about 3 months. So everyone have opportunity to bring your case into supervision and have opportunity to learn from the other. Yeah. And then you need to participate in Vipassana course. Yeah, that count. Yeah, that count. Yeah. 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 This you already have this Vipassana course that count, but you need the other 3. And this usually finish in 6 months interval if you do it diligently. Please.
How will the supervision take place? Because we're all gonna probably disappear into different time zones and have clients from different time zones, and I just worry that you also need to
We
sleep.
try our best because it's online supervision.
Right.
So we try to set the point that everyone can participate.
No, but so when we're going, so if we've got 15 people on the course, well, 12 people on the course, that's a 2-hour session twice a week, one individual, one group, every week for 2 months. How is that? How will you be able to supervise all those sessions individually? Like, especially if, say, for example, the UK is 7 hours behind. So it means that if they're finishing work at 5 p.m., I can't run a session till the early hours of the morning. And obviously, people got kids and all this kind of stuff. So weekends are not always. So for me, if I'm working with UK people, it's going to be like probably between 1 and 2 o'clock in the morning. It's going to be reasonable for them.
When you do the session, you do by your own.
Right.
But you bring that the session that you do into the supervision, and then you get feedback.
Right.
How to do it better.
So if I understand it correctly, because I think this is probably a question that everyone has, we work with like you're not sat in there live watching every single person work with every single client. We work with the client. We have our own kind of evaluation form. And then the supervision is us bringing that to a session with the class where we all share our experiences based on what we've recorded. Is that correct?
Yes.
Does
And
everybody
then-
understand
and-
how that's going to work?
And I will show you the statistic. We supervision for 3 months, so it's
Right.
about 12 times.
Right.
Each time we allow to talk not more than 2 pages to client. So all together you talk about 24 patients, right? Or group individual or group, and that means every single one of you don't bring every session to the supervision.
Right.
You bring only some session to the supervision, but you will knowledgeable for every session because you learn from other. For example, you bring session 1 and 4 of your therapy to the session.
Right.
But Thai bring session 3 and 7 to the session. It's going on like this.
So
So
it's like
all
a
together
holistic group.
in the 3 months period, everyone will learn a lot, not from yourself only, but from colleague, how to dealing with the session and client.
And with respect to the group, what is the minimum requirement to be classed as a group? So again, it's like we recruit an individual participant for the 1-person component. For the group component, what is the smallest number of people we can use?
Everyone need to conduct 1 group
Yeah.
and 1 individual.
So I understand. So I'm saying for the group, what counts as a group? How many people is a group? The minimum?
5.
So we need a minimum of 6 people to complete.
Five or five.
So no, so I'm saying in total, we need 1 individual and at least 5 people to make the group.
Yes.
What if that's not feasible? I think to get 5 people to commit to 8 weeks,
Yes.
it's not entirely feasible for everyone. So say for example, if you could only get 3 people, can that count as a group? Like
Yes. This is come from our experience that along the way of 8-week session,
people drop
some
out.
people drop out.
Yeah, right.
So when you have 3, then 1 drop out, you have only 2. So it's not seem to be a group.
Yeah.
But if you have 5, even 2 drop out, you still have 3.
Yeah, and I
So
suppose
that can run the group process.
I don't know why people find that funny. Like I'm baffled.
Can that individual, can they be in the group too? They do 2 kind of patient, like individual 1 person, and then that person wanna participate in the group. Is that okay?
No.
No?
It works differently. When you run the group, that people participate in the group only.
Okay.
So it do separate.
Okay. Okay.
Yeah.
So just so I'm clear, the assessment, we do our classes first, whether it's in person or in group. Because I'm going to do mine in person. I've got maybe 4 people already, but I'm going to do it face to face. Is that okay?
You mean group therapy?
Yeah, in my group, I've got maybe 5 people, but I want to do it physically, not online.
Actually, we recommend on site.
Okay.
But if you cannot do, you can have the second alternative. Do it online. We certify both.
So when I finish my 5 group of 8 weeks, I make a log, a practical log of my reflections, and then you're going to make a group for supervision.
Our group,
yeah,
will go into the group supervision after we have a period of more than 1 month for you to certify.
So how will you manage that? Because we're all going to be in different countries.
Yeah, we do on Zoom or we do online. So we will choose the time that every corner of the world can participate. Yeah, it's difficult, but it can. But someone may be a little bit difficult. For example, you need to awake early or go late to before your bedtime. But it can be.
Yeah.
Mm-hmm.
Yeah.
Yeah, you are right.
Okay. Okay.
Mm-hmm.
Okay. And what was the Facebook? Because I don't use Facebook and I won't use Facebook.
The
I don't like it, so I
actually
won't use it.
the one that work very well is the line itself. They have a very good service that people can do online. Our line group can do supervision, but we can do on other, for example, Zoom or the team Google team.
Okay.
Team meeting, yeah, Google meeting. So we will ask first which one people get together. Yeah, the bottom line is the line group. It can do online supervision. But if you can do something more, you can do team meeting from Google, or you can use Zoom but
Okay, so did you mention, I could be wrong, the individual, we need to share our experiences on the line group with each other? So how often do we do that? Because I can
Once a week,
imagine what's going
once
to
a-
happen. We're just going
once
to get bombarded. And I
once a
tend
week.
to turn off it. And I don't want to get bombarded after this course. So,
It's once a week and you need to participate at least 80% of the time.
so will you have a set time we have to do it? Or because obviously
Later,
11 o'clock at night, I am not going to read somebody's experience of
Yeah.
what they've done. So are you going to set a time? So say Friday, just say hypothetically 5 o'clock, we all start sharing our experiences, or is it going to be random? I don't know. Am I making myself clear? Yeah.
I
And then you can or we can like vote one good
yes,
one.
yes, we will vote.
Because we usually like pick one options and then it's always fell off. And we always like scramble with that. So
Mhm. I myself, I do some international supervision, people in America, in Europe, and then in Asia. And then we find that at about 8 o'clock in 8 p.m., everyone can participate. Yeah. Even in United States, it's 8 p.m., it's 8 a.m. in America. And Europe is in between. 6 hours.
2 in the morning.
Yeah.
I have a question. I think it's Johnny might have mentioned it about the intake, the client intake form. So I've trained before on one of these 8-week trauma-informed mindfulness things, and we have a screening process for that, because obviously the laws in the UK, you need to basically have certain things in place. So we have a screening form. I've got the handbook, and it's like, is the client diagnosed with epilepsy? Do they have difficulty breathing? Have they got an illness? Have they had suicidal thoughts? Are they pregnant? And this helps us to determine whether or not, as unqualified, therapists, non-registered therapists, that we can limit liability. So say, for example, if here on this general form, you got stress, anxiety, depression, hypertension, diabetes, there's all these kind of things. Pregnancy is not on there. And also, there's nothing, it's just like collecting information rather than saying, look, if you have a condition which may be affected by it, get approval from your doctor first. Because if they come into a session with us and start doing an 8-week program and something goes wrong, and they say, well, he's been telling me to do all these practices, if we don't have a proper screening process and we haven't informed the client that they should seek medical approval before engaging, then we might be liable for, for them to make a claim against us. Or
during practicing as therapist, you are not allowed to do if you are certified as counselor, you are not allowed to do the mental health group.
Yeah, so I understand this. So like, what I'm saying is, in the handbook, I can't see like an explicit disclaimer that says, look, this is not a form of medical treatment. It should not be substituted for medical treatment. If you have any serious illnesses, please get the prior approval of your doctor. Otherwise, we can't accept you on the course. And then get them to sign it to say, I agree with all these things, just from a liability perspective. And maybe it's not really the culture here in Thailand, but it very much is in the West. Like, people will try find an excuse to make a problem. And unless we're properly insured, you know, it's
I
it's a
understand. So
risk.
I respect your country regulation.
Yeah,
But
yeah,
in
yeah.
Thailand, we don't need it.
No.
Yeah, if you become counselor, you can give service to anyone who have adjustment problem. But if your country have different regulation, you can follow it.
Do you want me? But I mean, just for the purpose of like this program, so if it's the case that you want MBC to be more like internationally used, it can be more researched. If you want, I can send you what I've got from the previous thing. It could be worth just adding something in the handbook just to maybe, because if you recruit from IBSC and half of us are foreigners, then it makes sense just to have something in the handbook to protect everyone wherever they are.
Thank you for that.
So what I'll send you what I've got, and then
send into our live.
Yeah, then you can just copy it. But I've found that like I've done the yoga training not because I want to teach yoga, just because I can get insured as RYT. You can get insurance so that if someone does have a problem, then you protect yourself. Like, I think you've got to be careful with people coming in for mental kind of things.
This is quite complicated from country to country because we work with human beings, no? So they have some regulation, some legalization, and some ethical issue. Yeah, I understand. Yeah, please.
Yeah, really important things to consider when practicing. I think just a few practical questions about the timetable. So after we finish the 1 month period of personal practice and sharing, so the timetable would be around March, sometime March, when we would begin with the group and the individual clients. So that would be the preliminary timetable we would need to prepare
separate
for.
to self-development and sharing into your practice into the life.
Yeah, okay, so that's what we need to be sort of like make the arrangement for. If in instance some of us can't for personal reasons or practical reasons arrange the group for this time, and we certify as a basic therapist or basic counselor, basic certificates, if we can, for example, arrange the group in the autumn or maybe next year, can we participate in a supervision later after getting the basic certificate now? So we can arrange it with you. Can you arrange individual supervision for that, or do we join another group when it's available?
We ask you to join group supervision first. Even you don't have case, you learn from the other, and then after 3 weeks, the group supervision will close, and then the next option is that supervision on demand. So you write down that you need supervision of this case, and then I will make in online supervision with you, and other who can participate. That is on demand.
Okay. So
it's not regular.
Okay.
And it's not compulsory. Everyone can participate or not, depend on.
But so just to check, so we would join this supervision group for 3 months, even if we don't have a group.
Yes.
3 weeks, sorry. But if
3 months.
We will join for the whole
the
process.
Supervision will continue for 3 months.
Yes, but if we don't arrange a group at this for this spring, if you can't, for like practical reasons, if I can't arrange a group for now, I won't be joining this supervision group. Yes, but if I can, for example, start with a group in the autumn, can I then ask for on-demand supervision from you, and then qualify later through this supervision with you individually as a get the advanced?
Yes.
Okay.
Yeah. Usually we demand, we ask or demand that you will complete this in 1 year, no? Because if in 1 year you don't do anything, and then you will forget a lot what have you learned. So you need to do it in 1 year. after basic certification, 1 year after that.
Thanks. For the practice for 1 month, do you have a document that we can log and then we send the
Yes,
document
yes,
to
that
you?
is already in your life book.
Okay, and then we send it back to you?
Yeah, yeah.
Okay, okay. And then we will arrange to have this discussion online with our
Yeah.
experience.
Uh,
So when will that be arranged?
It's
please?
most likely to be 8 or 9 p.m. And it will take about 1 hour and a half for each supervision. And 1 hour and a half for 2 cases. That means 1 case is about 45 minutes. No, every week for 3 months. So it's about 12 sessions of supervision.
Okay, but for the certificate, this line communication to share our experiences, when will that happen? Because we have to do practice for a month and then we have to share our experiences online, right? Did you say that?
For the, you mean for this?
The certificate.
The certificate for independent therapist, you need to fill in the other form. After this, I will send you, when you already, most of you certify as basic therapist, I will send you the new form to be filled in when you go to other 4 requirements.
Okay, for the basic certificate, this is what I'm focusing on right now. We do a month practice. We log that, we send that document back to you. And then there was something about sharing our experience with the others.
Yes.
So how will we do that? How will we share our experience?
You, for example, you sit and then you have some experience, or you have difficulty of your relationship, and then you share experience, how you apply mindfulness to it. The experience of sitting, the experience of applying mindfulness into your daily life.
I think the question was where we share it.
In the line group.
In the line group. So
in the line
once.
Group. So no, share with the colleagues.
With the colleagues. So once a week we would like write up a summary of our practice for that week and send it to the line group.
We don't compulsory like that. Yeah. But we ask that during the month you must at least one share. Okay. Mm-hmm. So we just want. If you look after the record, if you need to record. In the fourth form, if you demand that you share at least one of your experience, and then you must record in the form at least one you learn from the other experience. It's already in the form. For example, today I have problem with my wife, and then I learn how to managing with my thought. So I lie down, and then I get the experience from you that you encounter with you sit, and then you have some experience of sitting, and I like that. I also show that I learn from you. Yes, that is the minimum. Yeah. So far, as I know, for this group it's not difficult because you meditate a lot. So to do the third is not difficult. And the fourth one, as the minimum requirement, is only one of your experience and one you learn from the other. as
Or-
I just said that you have already do meditation retreat in this program. You can apply that. Yes, but you need to write down in the egg form about your experiences. Yes, yes. This one. The Matthew, the eighth one records participation in the retreat course on Vipassana. So we have a form. You just fill in. It usually asks about what compare between mindfulness based intervention and Buddhist Vipassana. You can.
Filling out. You're just filling out the form based on the retreats that you've done, and it asks you to reflect on the differences between the MBTC practice and the Vipassana. So I said, well, one of the differences, instead of focusing on the breath here, we usually focus here. And instead of doing mental rehearsal, we don't. We just go to Dhammanupassana or whatever we're doing at the fourth stage.
But you also need to see what is the similarity.
And we can see
not,
the
not only the
similarities as well.
difference.
Yeah. No, I think yeah, it's pretty
Vipassana have the same principle. Either you use observing your domain or you observing your breath. They have some principle. For example, the principle of impermanent. So you must write down these experiences.
And it also, anyway, it's the same because you have Kayanupassana, you start with the breath, then you go to Vedanupassana, which is a body scanner. You're looking at the feelings and emotions. Mental, you've got the management of thought, which is Chittanupassana, which is the thinking, and then mental rehearsal just replaces Dhammanupassana, or could be like open monitoring. So the actual 4 parts is pretty much the same, just with a different language, I suppose.
Yeah.
There you go, then write down.
Okay. As the time is over, I would like to mention that our line group still open for any question. Yeah, if you have, you share, the question is not only answer you, but also help others, to understand the process. So you can, you have any problem, you don't, please don't send email to me. Because anyway, I will answer it in the line group because we want the group learning. So don't send to me individually. You can, but anyway, I answer in the group. Yeah, that's our way of learning. Yeah. Okay. You have my email, that you can contact. Yeah. Yeah, maybe something you, yeah. Yeah. Yes, you get the slide. You get the vulnerable will send to you. So I hope you learn.
Thank you very much, Ajahn.
Enjoy and become happy with this MBTC, Yeah. Okay.
Oh, okay, get it. Okay, so but for 8 weeks, we still have to do session 8, right? Okay. Another question: you expect everyone to conduct in English
Because if I bring this back to Taiwan, the language I'm going to use is Chinese. Then how can you supervise?
No, I think I should use.
But they don't understand. I got I bring my question with someone. Okay, maybe oh, it means that you don't go to my own group and then what? Then maybe there's some misunderstanding over there. Because according to Matt, maybe he thinks that you will go to every group and then monitor what's going on there. Now I understand you like a win to cut down the session, right? Then we bring our experience back to like to talk. It's like a Apple interview, right? In the retreat, we practice, and then every week we bring the experience to the Apple and then interview, right? Like that, right? Ah, okay. Maybe so based on the understanding, I think. Huh? Yeah, I just, I pay respect to you. You are, have so much patience. That's how you express. I think some people would do it.